kick things off today with Robert Rodriguez, the CEO and co-founder and chairman of HelixVM. Robert, how are you?
Sorry about that. Good morning. Can you see me now?
We can see you now.
Okay, there we go.
And that's you can see
Sorry
you now
about
as well.
that.
Good to see you.
Good to see you.
No,
Good
no
morning.
worries. And Robert, just for people that aren't familiar with HelixVM, if you could just give us a 1 or 2 minute thumbnail on the company.
So HelixVM basically is a startup. It's a software platform, a service platform that basically brings together patients, doctors, and depending on the situation, or a referral provider into a clearing and settlement platform. And that clearing and settlement platform looks a little bit like a digital front door. It looks a little bit like RCM in the background. But fundamentally, what we're trying to do within that platform is to enable as much sort of quick asynchronous medicine between patients and doctors, and with the hope of, in essence, making things faster for the patient, making things more profitable for the doctor because it's quicker, and obviously being able to satisfy referral partners' need for quick resolution to medical needs that exist in their store or on their website, wherever that may be.
That's brilliant. And we've seen a really, HITLAB has done a bunch of studies with you guys now. We've seen a really nice evolution of the platform. Talk to us a little bit about your vision of what asynchronous care is going to look like in the US and how you've evolved and really moved the company to new heights by evolving with that vision.
Well, the use of asynchronous medicine inside the practice thereof is not new in the sense that it hasn't been done before. It's been around. You know, the issues that happen with respect to asynchronous medicine are one of adoption, particularly between patient and doctor. And we're very early in the adoption curve. Okay, so patients aren't necessarily sure what to do with it. Doctors obviously have some concerns with respect to, you know, efficacy and safety. And so as a result, there's a lot of thought around it in terms of using it in some capacity, particularly with the explosion of telemedicine since COVID. But fundamentally speaking, the processes around seeing a patient asynchronously versus synchronously are very different. And especially around the whole idea from a physician perspective of the amount of data that you need, the volume of data, who collects it for you, do you trust it, subjective information versus objective. That's on the physician side. And then on the patient side, there's a lot of, you know, uncertainty. People aren't used to shopping medicine, a medical service, the way that they would shop a product, right? Product, you go on Amazon, you order it, you know, you get it a couple of days later. When you're ordering a service, what exactly am I getting? And so bridging that gap is very, very important in the short run in terms of developing this modality of medicine for physicians and patients. Long run, you know, at the end of the day, I think that, you know, with the use of AI and machine learning, you're going to start seeing basically physicians using this mode of medicine to be turned on 24/7 and to be able to, in essence, manage their patient base, both in an episodic fashion as well as also on a chronic care management over the course of a cycle. And so, you know, the workflows get a little bit more complicated, but fundamentally speaking, what it does is it helps the physician just be much more efficient with the patients that they have and spending the right amount of time with physicians when needed.
And this is really, from HITLAB's standpoint, we look at thousands of technologies a year across the digital health ecosystem, and we're testing many of them. And we've seen some really novel elements of what you're doing. From your perspective, what is HelixVM doing? Tell the audience what is novel about it that's creating these new efficiencies and these new accuracies in the healthcare system.
Well, some of the things are basically really in the digital front door. I mean, our digital front door does a lot more stuff, okay? It goes beyond, I think, what a lot of the digital front doors offer in terms of the degree of completion. So we look at it as for example, that we're clearing a patient to be seen by a doctor. We're not just getting your insurance. We're not just getting your demographics. We're not just doing some triage on you. We're basically clearing a trade. And so we use sort of a Wall Street term, but it makes a lot of sense for a physician, right? Because before the physician goes into that room with the patient, they want to know that everything is organized properly, that everything's been checked, that, if I need labs, that the labs are there. And so we really focus, I think, on clearing a trade for the doctor. And I think that that's very unique to what we're doing. I think the second part what we're doing that we're building towards is I think we are also making the service experience for the patient a little bit closer to what they would expect of an e-commerce type platform. And that obviously is, a vision that we have, which is that, the patient should begin and end in 15, 20 minutes. They shouldn't have to sit around and wait. And I think that that is also extremely novel, where, we're looking at it from the perspective of the patient, sitting on their couch, and just like they would on Amazon, they surf, they find, they look, they shop, they hit the purchase button, and then something happens magically. And so we're looking to bring that also to the patient. So we're looking to have a little bit more of a consumer-oriented approach, as opposed to a hurry up and wait, which is endemic in the medical field, right? You hurry up and then you got to wait, right? Who are you waiting for? I'm waiting for the lab. I'm waiting for the doctor. I'm waiting for this. I'm waiting for that. So I think that those are the two aspects of what we're doing, which is very unique.
And obviously, everyone's talking about artificial intelligence today and how that's going to change healthcare. There's been a lot of evidence and a lot of data about how AI is changing the world in healthcare. How is HelixVM implementing AI, and how is that making the experience, like you just said, easier for the patient?
Well, AI to us, AI sort of, we kind of divide it a little bit, from sort of very low tech, sort of, robotic process automation type stuff, up to, more of the, working with unstructured data. But fundamentally speaking, for us, AI plays an extremely important role in the information gathering from the patient, and then the synthesis that we provide the physician and a medical note. So we work, the AI basically looks to create a medical note for the doctor, which would include obviously subjective information the patient gets, like, their social history, their past medical history, combine it with the present illness, the HPI as they call it, and the problem that they're trying to solve, in order to, in essence, generate what would be considered pretty much close to a full SOAP note, and then marrying with treatment protocols that the physicians, in essence, dictate themselves. I want to treat this way, I want to treat that way. Where I see AI taking a next big step for us is, in essence, in basically baselining how physicians would treat patients based on the same data. Because we all know that a physician, you put 10 physicians in a room with one patient with the same data, and you might actually get 5 or 6 different treatment plans. So we want to be able to capture that variance around the mean, which is something that typically you don't with sort of the larger AI models, or for that matter, the model that we use today.
Which makes a ton of sense. And so when you think about the strategies that you are deploying to ensure accuracy and reliability for those diagnoses that you were just talking about, and the treatments that are going to be provided in the platform, how are you using technology and then certainly human intervention to double click on that?
Well, first and foremost, you're acquiring data from the patient, subjective information that they give you, just like you would when you go into the doctor's office and they give you all those forms. And then the second part of it is what we're doing is we're tapping into data warehouses in order to supplement that with what we would call objective data, objective being information that we get from license holders who have medical licenses. Who has medical licenses? Pharmacies do. They have pharmacy records. Insurance companies do. They have also not just insurance information, they also have ICD codes, CPT codes, and basically history. You can also tap into things like, Prisma or, MyChart, in order to, again, continue to sort of bring information into that file in order to address the uncertainty that the physician has. And the delicate, so that's what we do in terms of trying to assume and build, in essence, quality in the diagnosis. And so that's number one. And then the second part is, we still require, and at least on our platform, we require the physicians to review literally every single note. So no matter if the AI does all the work for you, you still got to look at it and you got to read it. And you have to make sure that, in essence, that there's agreement. And most of the time there is.
Which is bringing me to my next question, because we've obviously done a couple of studies with the HelixVM platform at the lab, and we've seen incredible results, and we've seen ways people are using the platform that we would have never guessed. Tell the audience a little bit about that and a little bit about what you've seen with the platform's adoption and how different stakeholders are using it in different ways, because that's really been an incredible finding.
Okay. So I think, it really starts where demand manifests itself. So, we have patients who are in a pharmacy and they want something. They don't have a prescription or they don't have a doctor. We have patients who are surfing the net and they're interested in, a GLP, but they don't know where to go. Or for that matter, patients who are interested and they had an authorization that failed for whatever reason. So it really starts with, in essence, bringing in patients who are have a need and an immediate need. Okay, number one. And so as a result, the ability to capture those types of patients and process those patients and clear them for the physician to look at them. Number one. Number two, the other thing is, as I mentioned, is that we try to work with, license holders in terms of getting referrals into kind of our provider network. And that's also unique. And we're doing so with a white label type approach. So there's that. And then I think, again, on the physician side, what you're talking about here is a speedier way of at least bringing in the patient in the first time, a case management model that allows them to sort of treat just enough to get them going. And eventually the physician will see the patient, but they don't see them as much as they used to. So instead of being in the office, every 3 months or 6 months, maybe you're only in the office every year. And pretty much the rest of the care is in essence done over the platform and periodically, and a lot of it is actually done with asynchronous medicine.
And that's fantastic. And our next guest is running behind. So if there's anyone in the audience who has any questions, ping me on LinkedIn. Again, I'm going to put my LinkedIn chat in the chat box. So if you can ping me on LinkedIn, send me your questions there or put them on the chat box here. But certainly we were going to keep this conversation going. Robert, if you could, one of the things that we've seen that really do come up all the time with the platforms that we're testing and with the ecosystem when it comes to digital health technologies, whether it's a remote patient monitoring technology, asynchronous technologies for patient communications and physicians, or AI, is what's happening with the data, how is it being secured, where is it sitting, those sorts of questions. If you could, tell us a little bit more about what you guys do with the data and how you secure it, how you protect it.
Well, our approach is, again, unique in the sense that when we capture the data, first of all, the data for the patient, when we capture it, we anonymize it, because at the end of the day, for all intent and purpose, we don't need to, we only need to know that there's a case and a patient on one end, and then there's medical information on the other. And so as a result, for example, when we feed the AI the data, we don't feed the AI any information that has to do with, that can identify the patient. So as a result, when we get back a diagnosis, it's basically, we're in essence matching a diagnosis and a chart to a patient case. That patient case goes to the physician, and then that information in our system, in essence, ceases to exist from a perspective of personal information. It then goes into the doctor's EMR system where it sits, and it stays in the doctor's EMR system, because in the doctor's EMR system, because we don't take the doctor out of their EMR, we keep them in their EMR. And then what we do is we put all the data and all the information in there, and those systems are typically much more robust. Regardless of how you put it together, you still have to be HIPAA compliant across the entire supply chain. But typically the data risk that you take with us is less. That's number one. You had also mentioned devices, and the interesting thing with devices and data with devices is that obviously devices are constantly providing the data, and I think that the challenge for a physician practice is, what do you do with it? Because most times physician practices are typically looking at that data after the fact, 1 week, 2 weeks, 3 weeks, 4 weeks, 5 weeks, 6 months, and obviously as a result, that information somewhere either could be in our system in the future, but it could also be in an EMR system. You sort of need a dashboard. And you need that AI constantly running against the data, not to just spit out useless information that nothing's changed, but to be able to identify, hey, listen, there's something here that we should be concerned about. And so it's in essence kind of a dashboard that's going to basically help identify hotspots of patients based on the ICD codes that they have, and then basically saying, hey, listen, we noticed that this diabetic, their blood sugar spiked 3 times in the past 24 hours above 200. That's a problem. Versus, oh, we noticed that their blood sugar spiked once, but it's been normal the rest of the day. So you need to bring the data in, you need to run that data against a model, and then you need to be able to have those kind of clinical policies in place to understand what's important versus what isn't. Because the more you measure, the more stuff you find. And not everything that you find in medicine, frankly, is important.
That's right. That's exactly right. And I think, one of the things that we're getting a lot of messages for here, a lot of questions, are people asking about just the throughput, because there's so many scripts being written now through so many in this kind of a platform. How are you planning to scale? Well, what kind of plans do you have to go from 100,000 to 1 million to 100 million? Because this is the kind of platform that we could see really taking off. And what are some of the scaling plans that you have?
Well, look, at the end of the day, there are still people involved in this process, okay? And that's something everybody needs to understand. At the end of the day, it's not a legal medical note until a doctor signs it. So, and for a doctor to sign it, they're going to want to read it. So there's always going to be some aspect of a scalability which runs into the fact that you need to find physicians who buy into the style of medicine, okay? The good news is they don't have to spend 15 minutes on something or 20, they can spend 1 or 2. So I think that's the first thing. So for scalability from our perspective is in essence about lowering, first and foremost, lowering the amount of work that the physician needs to do. But there is obviously a human component to it. On the patient side, it's really, I think, probably a bigger issue because clearing and settling trades, the computer, if you put in everything perfectly, the computer system does a great job of getting you everything. The problem is that patients don't always give you the right data. And so particularly when you're dealing with newer patients. So the scalability issues that you have aren't so much on if I get the information perfect from the patient, it's when I don't get the information perfect for the patient. And then you're sort of stuck in an exceptions management process where you're communicating to the patient, but you're not always hearing back. And so sometimes you hear back 2 days later and 3 days later, and then what happens is your queues, your work queues from a clearing perspective can grow very quickly. And so it gets a little messy operationally. And again, these are things that you can solve a lot of it with technology, but fundamentally speaking, you're still going to continue to have situations where the patient's like, I don't understand. What do I need to do next? And you're basically, working from big problem, design technology around it, to smaller problem, design technology around it, to even smaller problems. So, and again, this is where the scaling, the ability to scale is a function of rolling out things like contextualized messaging within the platform for the patient. So that way, when they're done, they know that they're done. If there's something missing, they know something's missing, and being able to do so in a way that isn't just sort of a standard message that gets spammed on the patient side. So scaling is something we are honestly, we're still working through from the perspective of growing and growing very big. But but we are able to today process a lot more patients than a regular medical practice for every unit of labor capacity.
It's fantastic. Well, Robert, thank you for joining the program today. Looking forward to seeing and hearing more great things about HelixVM.
Appreciate it. Thanks for the time.